Hey everyone, this is Dr. Spencer Zimmerman here for our weekly live Q&A, but to also review topics that are near and dear to each and every one of you. Ultimately, I'm going to transition this as we're launching our podcast, Brain Reset. So, Brain Body Reset, because it's really about full body health. It's not about separating the body into all these little pieces. It doesn't work as well when you do that, right? So we've got to connect the body as a whole. So as you're watching this, please ask me any questions that you've got. Yes, this one we are going to dedicate it more to concussions. For those of you that maybe you've suffered one and haven't been diagnosed. For those of you who've been diagnosed but are struggling to get better and not sure what to do. Those of you I work with a lot who've suffered car accidents, and you've got other providers who are like, well, you couldn't have suffered a concussion. It can't be that. And there's a lot of bad diagnoses out there in the concussion world. And so we are going to go through what should actually happen when you're diagnosing a concussion. So that way you can get the proper diagnosis and ultimately have a path to lead you to the proper treatment. So be sure, leave me comments and subscribe to this channel to help others. All right, so we're just going to dive straight into this. How many of you have suffered a concussion or have wondered if you have? Well, in reality, if you played sports, you've been in car accidents, other things like that, there's a really good likelihood, at least at some point in your life, you probably did suffer a concussion. So how would you actually diagnose this? And that is going to be the topic of this conversation. So we're going to start off first going to the research, right? For the longest time, concussions were just, it just wasn't as good as it should be. But there's so much more that we can do. So I'm going to share my screen with you, and we're going to go through the research. And what does it actually say, and why is this important? All right, here we go. So this is the American Congress of Rehabilitative Medicine diagnostic criteria for mild traumatic brain injury. So there's often a lot of people who should be diagnosed with concussions who aren't. There's also those who get diagnosed when they shouldn't be. And this creates frustrations on both sides because concussions are a really big issue. But if we can't get the diagnosis right, then they keep being minimized. And unfortunately, many people continue to struggle for months and years following the injury. And having a bad diagnosis one way or the other hurts everyone involved. So, all right. So basically what there was this whole task force put together, and they put together the recommendations of what should be done for diagnosing a concussion. Please, if you have questions, let me know, comment. So the very first thing, all right, we're going to pull this up. So this is a map as to whether or not someone suffers a concussion. So the very first thing, we're going to dissect this, okay? And if you've got questions like, well, could that have caused a concussion? Feel free to ask it, right? We're not here to judge. We're here to help. And that's it. So the very first criteria of a concussion is the mechanism of injury plausible, right? Could what have happened cause a concussion? Yes or no? And we are going to break this down as to what it means. So once again, right? If it does not meet criteria for diagnosing it, then it's something else. But next is clinical signs, one or more. Clinical signs are big. I read a report today from a psychologist who said someone couldn't have suffered a concussion because they had none of these clinical signs. But as we learn here, you don't actually have to have clinical signs to get diagnosed with a concussion. That is not required. But what do you need to have? You need to have acute symptoms, 2 or more, which we will review what those symptoms are. Also, you should have the right clinical examination or laboratory findings. Now, at this point in time, it really is about the clinical examination. We don't have the laboratory findings that we really need. And then lastly, if you do have neuroimaging abnormalities, then that automatically tips you into the concussion world as well, okay? Or you're actually beyond that usually if you've got something on there. And we'll talk about some of the imaging as well, where we're at, What don't we know? Because if there's something I've learned in the concussion world, there's all sorts of things that people do. Sometimes it makes sense. Other times they're just doing it out of desperation because they want to feel better. And I don't want you to be taken advantage of. I want you to know what you should be looking for when you're getting help. Did you get a valid diagnosis? Should you maybe have been diagnosed with something else? So you can actually advocate for yourself and get the proper care. All right. So the very first thing is the mechanism of injury. Could you have suffered a concussion? All right, here we go. So when we look at criteria number one, so right, it breaks it all down for you. Mild traumatic brain injury is diagnosed when one or more of the criteria are met, right? One or more clinical signs, at least two acute symptoms, neuroimaging evidence, right? And then there cannot be a better explanation, right? So if it's like, well, my balance is off, but yet you were drunk, then we can't say that caused it. We've got to make sure we can truly separate it. All right. And then it's super important that we look here. Concussion, the diagnostic label concussion, may be used interchangeably with mild TBI when neuroimaging is normal and not clinically indicated. Cool. All right, everyone following along? So, very first, could you have suffered a concussion? Mechanism of injury. This is critically important. I'm going to blow this up a little bit the best I can to make sure everyone can see this as good as possible. Traumatic brain injury. Now, once again, traumatic brain injury is a concussion, okay? They use them interchangeably because traumatic brain injury, basically there's a physical force to the body or to the brain that ultimately causes it. So when we read this definition, traumatic brain injury results from transfer of mechanical energy to the brain from external forces resulting from the head being struck with an object. Now, that's what most people think of when they think of a concussion or a brain injury, right? The head being hit. 2, the head striking a hard object or surface, kind of the same thing. 3, brain undergoing an acceleration, deceleration movement without direct contact between the head and an object or surface. So what that means is a whiplash mechanism is enough to cause a concussion, right? So if you go forward and back, you don't have to hit your head on the back headrest. You don't have to smash the steering wheel. You don't have to hit anything. That would be a plausible mechanism of injury. 4, or forces generated from a blast or explosion. Okay, so we saw this a lot with military veterans in Iraq, Afghanistan from IEDs and other things like that. So once again, super important. This has to be met. And unfortunately, there's a lot of myths out there where I've seen it and it frustrates me because it leads to people not getting the care they need. Such and such person says this individual could not have suffered a concussion because they did not hit their head. And like, I don't have a lot of hair to pull out, but I want to pull my hair out because when we look at this, that's not the criteria. So let's please make sure we're getting people the right evaluation so they can get the right treatment. Cool. All right. So that's number 1. Number 2, what are these clinical signs? Now, loss of consciousness. Disclaimer, you do not have to lose consciousness to suffer a concussion. Loss of consciousness is only going to occur in about 10% of concussions, so we're not looking for that. Also, there doesn't have to be an altered mental status. That's not required either. Okay. Amnesia of events following the injury. So complete or partial amnesia for events immediately following the injury or after regaining consciousness. Now, there's a lot of people who have what's called post-traumatic amnesia. And, you ask them what happened and they're like, I don't know. I mean, I was like driving and then I got hit, but I don't know what happened. Like, next thing I know, I'm out of my car or someone's knocking on my window. Sometimes those individuals lose consciousness. Other times they don't. Next, Tua Tagovailoa, right? Observed motor incoordination upon standing. That's what he had. Seizure or tonic posturing. Now, you don't have to have these. If you do, it automatically tips you over, but you don't have to have these. Now, what are we typically going to see though, right? Two or more of the following: feeling confused, feeling disoriented or dazed, physical symptoms such as headache, nausea, dizziness, balance problems, vision problems, sensitivity to light or noise. Now, what you didn't see is vomiting all over the place. Once again, I have people who are like, well, my doc told me I couldn't have suffered a concussion because I wasn't vomiting. It doesn't even say it in here. It's not a requirement. Can it happen for some? Yeah, but it's not a requirement. Cognitive symptoms, feeling slowed down, mental fog, difficulty concentrating, and or memory problems. Now, mental fog is this really strange word that people use. So it can be, hey, I'm feeling hazy. I'm not feeling myself. I'm not processing as fast as I should. I've got problems finding words and other things like that. And then lastly is emotional changes. So irritability, depression, anxiety. And this is one that really frustrates me because it's known that concussions impact mental health. But yet in the medical legal world, someone will have this walking into it and they'll be like, oh, well, it's just all from their depression or their anxiety. It has nothing to do with the concussion. But yet concussions are known to impact it. You can have both. You can have pre-existing mental health issues and a concussion, right? You can have no pre-existing mental health issues and still suffer a concussion and get it. Cool, right? Now, last thing I want to say on this is the symptoms may be from one or more categories, but even if you just have two symptoms from one category, that's all you need. That is all you need. Okay. So, all right, everyone following along. So currently we've covered what's a plausible mechanism of injury, right? What are some of the clinical signs? What are the symptoms we should look for? And then this next one is crucial, crucial, crucial. I cannot tell you how many people I see, hint, over 90% of the concussion patients I treat have never had a proper clinical examination following a concussion. And this is devastating because ultimately you don't get the right exam, you're probably not getting the right treatment. So, what are we actually looking at? One is cognitive impairment on acute clinical examination. Now, cognitive impairment, this can often resolve in the first few days, so don't lean too heavily on it. Next, balance impairment. And we'll talk about what balance testing looks like. But balance can be off. Oculomotor impairment, right? So eye movements, and I'll show you some of the eye movement testing we do. Or symptom increase, right? As a result of that testing. So your eye movements can look perfect, but if it gives you symptoms, then that alone is sufficient as well. All right. And then we're not quite yet there, but elevated blood biomarkers indicative of intracranial injury. Now, we don't really have all the blood biomarkers we need yet. There's still a lot of research being done on that. But in the future, there's going to be things, probably S100B, neurofilament light chain, glial fibrillary associated protein, and maybe another one or two. All right. And then lastly, neuroimaging. Neuroimaging is not necessary to diagnose MTBI. Its role is to rule out head and brain injuries that might require neurosurgical or medical intervention in an acute care setting. That's it. That is it. So if you've ever been told by a provider that you could not have a concussion because your CT scan, your MRI was normal, they are giving you horrible information. There's not one criteria ever that says you have to have positive findings on imaging. If you do, you don't have a concussion. You've left it. All right. And then lastly, it just can't be better explained by something else, right? Like if someone's an alcoholic or they've over medicated or whatever else, right? You've got to take that into consideration. Or you've got someone who's autistic and you're like, well, their eyes are having issues. Well, yeah, most kids with autism, their eyes really have issues too. So you shouldn't do it in isolation. You've got to take the context of what this individual was before the injury,
where they're at now, what happened, what was observed, what symptoms were reported, as well as objective testing. When you do all that, you now set up someone for success. So, hope everyone's getting a ton of value out of this. And I know we spent a good bit of time reviewing this, but it is super important to make sure that the proper diagnosis is reached in an appropriate way, because for most, it's really not. I've seen people diagnosed with concussions and I go through and I'm just like, why? Right. And then I've had people who were told they didn't have a concussion. And it was once again like, but why? Right. We've got the criteria. Let's use it. All right. So we're going to keep going. So now the next thing we're going to go to is like, what is like eye movements, right? Like what are we looking at? So one of the tests we do is called video oculography. Now, in my opinion, this is a testing that should be done on everyone. Period. So I'm going to pull up a couple of different ones. Now, most people will never have this test done, so I should be clear on that. It's really unfortunate, but most people, they don't spend the money on the technology or anything else. So here we go. All right, so we've got someone's eyes, and they're going to start tracking a target left and right that's moving nice and smooth. So we want to say, are their eyes moving nice and smooth, or are their eyes skipping? Now, when we look at this, we see their eyes are skipping, right? I think we can say pretty clear these are skipping. Now, I'm a big fan of computerized testing because realistically, if I took 10 of my colleagues who all, let's say, are great at concussions, we're all going to document this a little bit differently. It's going to be mostly the same, but you cannot do a true before and after just from writing it down on paper or in your note as you can when you got the video of before and after. So this is called a pursuit. It should be smooth, right? It's called a smooth pursuit. Oftentimes, people with concussions have issues with smooth pursuits. They cannot coordinate it. And it's because usually with concussions, you get damage to parts of the brain known as your brainstem. Your brainstem is home to integration for your horizontal, vertical eye movements, whether it's keeping your eyes still, tracking left and right, up and down, or shifting your attention from side to side. Hey, Joe, thanks. Just out to share the word and help people get their health back. All right. So here we go. Next, let's look at vertical pursuits, right? What happens here? Now, this is super important, like people need to get the proper testing done. Are their eyes nice and smooth? Are they, going up and down smooth? Like, look at this, right? If you should be going up and down nice and smooth, is it in the vertical plane or do we see horizontal deviations? Often like zigzag or diagonal movements. We're seeing those. Shouldn't be there. Once again, there's a wide variety of symptoms people can have when their visual system is off. Chronic fatigue, neck pain, headaches, fuzzy, blurry vision, word finding, concentration, anxiety, dizziness, and so much more. All right, there's someone looking straight ahead and then the dot goes up. And so this is called gaze fixation. When they look, can they keep their eyes nice and still or are their eyes shifting left and right, right? And we're seeing a good bit of shifting left and right. So those are called square wave jerks. Those also shouldn't be there. That's an integration issue. And those are things that we can measure, but then we can also turn around and fix. So eye movements, super important. Please get them done. Yes, I get it, right? Lots of you are having stuff like this done. If it makes you feel bad, probably got a concussion or something else going on that's still impacting your brain. But if you can, absolutely, please get computerized testing done. That's the highest level. It's the most reproducible. You don't have to guess. You've got solid before and afters. All right, next is balance, right? So what should we actually look at when we do balance testing? So this is going to be the balance system that I use. It's nothing fancy. It gets the job done, though. It works really good. All right, so this is called B tracks. Okay. What happens is you stand on this balance platform and you're going to stand there with your hands on your hips, eyes open, and then eyes closed on a firm surface. And we're going to say, how well do you balance? You're then going to repeat it again on this blue pad. Now, you should naturally sway a little bit more when you close your eyes. That's okay. But we don't want to see a big increase. Now, one of the things that we know when we look at the research, long-term effects of mild traumatic brain injuries, and once again, long-term effects. So balance issues from a concussion you suffered can actually persist for years. Even though they say it's acute evaluation, it can persist for years. So if your balance is still off, don't just automatically brush it off and think, oh, well, my balance has to be good. And don't also, people think, well, my balance is fine. I'm not running into the wall, tripping over things, because most of you, you're not. So what do we see? Okay. The results reveal that balanced behavior of patients with MTBI deteriorate more abruptly in the absence of visual input when compared to regular people, right? So you close your eyes, your balance is going to be off more. So let's say you sway a little bit, eyes open, eyes closed, you sway 10% more. That'd be normal. Now you close your eyes and you have a concussion, you do a sway a little bit, eyes open, and then eyes closed, you sway a bit more. This is more than you want to see. And these are things that people are shocked all the time. So this is one part of the balance testing that can be done. All right, so we've got a couple questions I will get to. And then, all right, so from Sarah, if I've had a concussion, would it mess with my depth perception? And could it cause me to have another concussion by tripping and falling, for example? The answer is yes to both of those, because your visual systems can be impacted. And if your awareness of your environment's off, if you think something's 5 feet away when it's really 4 feet away, you may run into something that you shouldn't, right? You may trip over something that you wouldn't have tripped over. So absolutely. And that's actually something that they were saying here. These impairments might increase the likelihood of recurrent injuries and falls when time-constrained reactions are needed in daily activities, sports, practice, or military operations. So issues in your balance can really go and impact all of that. All right. So Joe asked, do you do 3 trials, eyes closed, then 3 trials on the Eric's pad, for those of you that are wondering, it's that blue pad. So that's what it is. So what I do is I do one with eyes open and it runs for 20 seconds. I do one with eyes closed for 20. I do one with eyes open on the blue pad for 20 seconds, and then one with the eyes closed blue pad for 20 seconds again. So each scenario is only performed once for 20 seconds. I don't perform 3 of each. Now, every now and then you'll see someone who's standing there and they're like fidgeting. You're like, okay, you know what? This looks off. But I also tend to spot check people. So I've got an idea if something looks funny in their testing. You can tell when you do it enough. Part of this is really trying to keep the length of testing down, because doing a full concussion evaluation, if you really want to do it all, it does take a lot of time, especially when you're using technology. So that's the part I do. And then there's another part that they have where you put your head in different positions. And there's some research that suggests that, hey, right, if your head's to the right and you close your eyes, it shouldn't be much more or much less than what it is when you look straight ahead. If there is a bit of a change, then that also could maybe be a subtle indicator of whether it's concussion or just overall brain health that's been impacted. Now, what's cool is, right, when you do this testing, you're then going to get a good printout of results. So, for example, when people come into my office, they're typically getting 10 treatments done over 2 to 4 weeks, sometimes even a week if they're flying in from another state, which occurs pretty routinely. But we see here eyes open, eyes closed, eyes open, eyes closed. And you see how the first two, you're like, okay, firm surface, not too bad. But then they go onto this blue pad, they start going up a bit more, but then they close their eyes and they go from 42 to 158. The less movement, the better, right? So this is almost a 4x increase. That is not normal. What is normal for most people? It's really between about 40 and 60, sometimes upwards of 70, right? Now, when we look at after they've got care, the 42 drops to 25, and the vestibular part, which is the most important, drops from 158 to 73. Disclaimer, we're not looking for zero. Only the elite rock stars are even going to score in the 30s. So we're not even looking for 30s, right? Once again, we're typically looking for 40 to 60, even into the 70s. But if someone improves, their score that much, you're going to be like, okay, you know what? They're probably feeling pretty good. And once again, this is good objective data because you're always at risk of a concussion. And while play sports, that's okay. You drive, you maybe do recreational activities, you may have kids, right? There's all these things where a concussion could occur. This becomes your new baseline. So you know if you're actually back to where you should be. Because there was a very interesting study done out of the University of Virginia. And I can't wait for them to produce more studies. But what did it show? Well, they were returning athletes to play based upon eye movements, cognition, symptoms, and balance. And then they did brain scans using PET scans. And they were looking at markers of inflammation in the brain. Now, this is a small study, so we need to make sure we remember that. If an individual suffered 2 or less concussions, their brain returned back to what would be considered a normal state with no inflammation. But if they suffered 3 concussions or more, their brain still was inflamed, even though the concussion they thought was better. So why does this matter? Well, there's probably a lot of people being returned to play, returned to life that shouldn't be because their brain is more inflamed and they truly haven't recovered. Because there's symptomatic recovery and then there's true recovery. And hopefully in the future, we are going to get more advanced imaging, more biomarkers, and everything else that can really help us know where someone's at in concussion. Now, why it's important to have this and realize that it's more than one thing is I'm going to pull up this last research and then we'll be ending it shortly after this. So if you have questions, please ask them. If you haven't subscribed to the YouTube channel, all right, here we go. So this is from an article called The Dynamics of Concussions. So it's basically a map of what happens in the brain following a concussion. From the time you have an impact, there's a cellular changes. There's also changes in how parts of the brain communicate. So this is networks. And then there's experiential. This is going to be kind of your experience of it from symptoms and everything else. And then the last thing is social. So the way it impacts your daily life. Now, if we're trying to bring a concussion and all we're saying is it is balance issues, right? Visual impairment, like executive function, we are missing the boat. And this, once again, can't wait for there to be better diagnostics and imaging out there, which we currently don't have. But because when you look at this, from the time you have a concussion, here's the big ones that occur. Neuroinflammation. You literally get changes in the immune cells in your brain. This, in my opinion, would be the most critical marker if you could measure it. It's what has happened with those immune cells in the brain, specifically your microglial cells. That's what they're called, right? If those have returned to a pre-existing state, you know someone has actually recovered. If not, it's like saying, well, do you still have ankle issues from when you rolled your ankle? Well, I mean, it doesn't hurt much, but the ligament's weak. It doesn't have the same stability that it used to have. And now you're at an increased risk of future issues. Same thing. If we can measure and say, wow, your immune cells have returned back to a prior state, that'd be amazing. Next, cellular energy imbalance, which goes hand in hand with the mitochondria. So if we can measure mitochondria and cellular energy imbalance, that would also be critical. And then lastly, the cerebral blood flow perfusion, also critically important. Now, there's some stuff being used on this. There's functional MRIs that are doing it. There's some people using SPECT scans like Dr. Amen. But even then, there's still not enough data on it and a universal consensus that it is still what we're going to consider very experimental. And for most of our patients, though, who do it, it really doesn't change anything as far as what treatment was going to be done. So we want to make sure that as things come out in the future, we have things that not only tell us where someone stands, but they're also actionable and we can use it to monitor progress. Should you be playing? Is our intervention working in the way we want it to? So, all right, I've probably covered more than enough of what you want to know on whether or not you could have suffered a concussion, symptoms, myths, working through a diagnostic protocol, all of it. If you have questions, let me know. I'll answer them. And if not, or else if you've just got ideas that you want to talk about next time, let me know because I'm doing these weekly. I'll also have other experts on. I'll have individuals who've dealt with concussion issues. So I'll actually have my wife on who's dealt with concussion issues for over 15 years before I started learning about this. And we discovered she, had concussions, right? So we're really dissecting this. But like I said at the very beginning, this is more than concussions. This is about overall brain and body health. Our body is a whole unit. You can't go in there and just replace one piece and move on with life. You need everything working together. Good brain can lead to a good gut. Bad brain will always lead to a bad gut. Leave a gut bad enough long enough, you're probably going to ultimately have a bad brain too. So we've got to connect the body as a whole and work together as a team and a unit and not separate out in individual pieces. All right. Well, thank you everyone for joining. And until next time, this is Dr. Z. I'm known as the Brain Guy.